Thoracic duct එක channel එකක්. මේ lymph flows before entering the bloodstream. මේක formed in abdomen and passes between the right crest of diaphragm and aorta. මේ thoracic duct එක related වෙන vertebral column එකට. However, the posterior intercostal arteries and communication of esophageal system passes behind the thoracic duct, conveys all lymphatics from structures below umbilicus. Thoracic duct drain into the left side, most commonly in the junction of internal jugular vein and subclavian artery, or may drain into internal jugular vein. Mediastinum elongates and shortens in inspiration and expiration respectively. Vertical diameter changes in respiration. The mediastinum extend up to sternum anteriorly and the vertebral column posteriorly. Mediastinum related to parietal pleural laterally. Mediastinal pleural. Mediastinum subdivided according to the position of the heart and pericardium. Mediastinum, if the pneumothorax is in right side, the mediastinum shift will be towards the left since the pressure increases on right side. Left ventricle has thicker wall since its pressure is higher. Right ventricle has eptomarginal trabecula which contains right branch of conducting system. Posteriorly related to the esophagus. Right ventricle principally perfused by right coronary artery. Right ventricle has lymphatics in its wall. Lymphatics follow coronary arteries. The right coronary artery, both aortic sinus lie below the aortic valve. Right coronary artery supplies the majority of the right ventricle. Right coronary artery has no valves in its origin. Right coronary artery anastomoses in the atrioventricular groove with the circumflex artery. Right coronary artery accompanied by the small cardinal vein. Esophagus, the average distance from the incisor to the gastroesophageal junction is 38 to 40 cm. The esophagus terminate at a level opposite the 11th thoracic vertebra. Arterial supply is via the bronchial artery esophagus. Middle 1/3 of esophagus has this supply. Esophagus a constriction occurs due to the arch of aorta. Lymphatic drainages of the esophagus: upper deep cervical, middle tracheobronchial, lower posterior mediastinal. Remnant and its origin: limbus fossa ovalis, septum secundum. Cornus cordis, smooth part of the right ventricle. Bulbus cordis, posterior part of the primitive right ventricle. Pericardial cavity is between the two layers of serous pericardium. Apex beats is felt at the level of the fifth intercostal space in the midclavicular line. Parasympathetic supply of the heart is by vagus nerve. Embryology of the heart: shunts mixed blood because the opening of the inferior vena cava, receiving oxygenated blood from the placenta and deoxygenated blood from the lower limbs and trunks is directed towards the foramen ovale. Ductus arteriosus prevents the overloading of the fetal lung. Pulmonary stenosis, VSD, right ventricular hypertrophy, overriding aorta are the features of tetralogy of Fallot. Pectinae muscles are embryologically derived in a primitive atrium. Gap junctions are seen in the intercalated disc. Heart එක ගත්තාම rough part of the right atrium derived වෙන්නේ primitive atrium. The smooth part of the right atrium formed by the incorporation of the right horn of the sinus venosus. Sinoatrial nodal artery arises from the right coronary artery in 60% of population. The sulcus terminalis marks the position of the crista terminalis. Sulcus terminalis is the external feature while crista terminalis can be seen from inside. Chorda tendinae are fibrous structures. Coronary ostia are found within the sinus of Valsalva. Sinus of Valsalva equal to aortic sinus. Septum primum, limbus නැත්නම් annulus කියන septum secundum. Fossa ovalis septum primum. ඒවා structure related to development structure related with embryological development. Truncus arteriosus is the distal cranial 1/3 of the bulbous cordis. එතකොට T4 T5 level එක ගත්තාම horizontal plane එක passing වෙන්නේ sternal angle through separates the superior and inferior mediastinum. Thymus එක තියෙන superior mediastinum එකේ. It lies in the anterior. However, it may be extended through the superior mediastinum up to the lower poles of the thyroid gland in the neck. Esophagus vein enter the superior vena cava at the transverse thoracic plane. Clavicle articulates with the manubrium in ball and socket joint. Sternoclavicular joint is an atypical synovial ball and socket joint. Bifurcation of the pulmonary artery trunks occurs just below the plane. Regarding the heart, right border is entirely formed by the right atrium. Base of the heart is formed by the left atrium. Coronary sinus open into the right atrium. Foramen ovale is closed by the septum primum. Increased pressure in the left atrial pressure the septum primum against the septum secundum closing the oval foramen. Thus, the septum primum forms the fossa ovalis. Bifurcation of the pulmonary trunk just below the plane. T4 T5 level එකට පිටිප එකේ පාලය. The right border of the heart is entirely formed by right atrium. Base of the heart is formed by left atrium. Coronary sinus open into the right atrium. Foramen ovale is closed by septum primum. Increased pressure in the left atrium. Left atrium pressures the septum primum against the septum secundum, closing the oval foramen. Thus, the septum primum forms the fossa ovalis. The smooth wall part of the right atrium is formed by the right horn of sinus venosus. Considering the blood supply of the heart, posterior interventricular artery arises from the circumflex artery. The origin of the posterior interventricular artery depends on the dominant artery. Right dominant 90%, right coronary artery, left dominant 10%, circumflex. Coronary arteries anastomose with the pericardial arteries around the roots of great vessels. Vena cordis minime directly open into the chambers of the heart. Internal thoracic artery is used in coronary bypass surgery. Coronary artery bypass radial artery, internal thoracic artery, great saphenous vein. Right coronary artery supply left atrium. Both coronary arteries supply all chambers to a certain degree. Left atrium contributes to the most of the base of the heart. Base equal to posterior surface. Base of the heart is formed mainly by left atrium, while the right atrium participates in very little. Left one is formed by incorporation of pulmonary venous system. Left atrium partly behind the left right atrium. Anterior part of interarterial septum is formed by septum secundum. Posterior surface form the anterior wall of the oblique sinus. Serous pericardium, the aorta and pulmonary trunk in the single pericardial sheath. Serous pericardium is lined by mesothelium. Serous pericardium helps to form oblique sinus. Visceral layer is pain sensitive. Pain from pericarditis originates from fibrous and parietal layer, which is refers the shoulder tip. Serous pericardium receives arterial supply from direct branches of the descending thoracic aorta. Rough part of right ventricle is formed by the proximal portion of the bulbous cordis. Muscular part is the lower part while the membranous part is the upper part. එක heart එකේ. Coronary sinus open to the posterior wall of the right atrium. Venous drainage of heart ගත්තාම great cardiac vein accompanies the circumflex artery, accompanies the left LAD and the circumflex artery. Venous drainage of the heart ගත්තාම anterior cardiac vein drains directly to the right atrium, right marginal vein directly drain into the right atrium. Venous drainage ගත්තාම directly into the right atrium or to the small cardiac vein. Venous venae caudas minimi are most abundant in right atrium. Conduction system of the heart ගත්තාම SA node is at the top of the sulcus terminalis. In most heart, AV node is supplied by right coronary artery. In 9% of the population, AV node is anterior to the left of the opening of the coronary sinus. Stimulation of right stellate ganglion may increase the firing rate of SA node. Bundle of His innervated by the bilateral vagus nerve. Thymus has no afferent lymphatic supply. Thymus doesn't receive any afferent lymphatics. Both the thymus and the inferior parathyroid gland develop from the third branchial pouch. A large thymic vein enters the left brachiocephalic vein. Thymic hormones are secreted throughout life. Thymosin is a hormone produced and secreted by the thymus and that is needed for the lymphocyte development. Thymus weight increases after birth. After birth, the thymus double in weight and maintain that weight even though it gets replaced by fat layer on its life. Phrenic nerve lies on serous pericardium. Fibrous pericardium is attached to the back of the sternum by sternopericardial ligament. Pain of the pericarditis is carried by phrenic nerve. Pericarditis is an inflammation of the serous pericardium. However, only the parietal layer is pain sensitive and is transmitted via the phrenic nerve. The superior vena cava lies posterior to the transverse sinus. The transverse sinus lies with the ascending aorta and the pulmonary trunk in front and the superior vena cava, left atrium and the pulmonary veins behind. Fibrous pericardium is attached to the central tendon. The fibrous pericardium and the central tendon are blended together as they both divide embryologically from the septum transversum. The tricuspid valve lies behind the midline of the lower sternum. Aortic orifice lie behind the left border of the sternum at the level of the third intercostal space. All valves lie behind the sternum, making a line with each other that is nearly vertical. Tricuspid midline of the lower sternum, mitral behind the sternum to the left of the midline at the level of the fourth intercostal space. Aortic behind the left sternal border at the level of the third intercostal space. Pulmonary valve behind the left sternal border at the level of the third CC. However, the sounds are best heard where the chambers of the channel lie closest to the chest wall. Normal heart sounds are heard by closure of the valves. However, abnormal sounds murmurs is heard due to turbulent flow through the orifices. Sound of the mitral valve are best heard over the apex of the heart. Cardiac apex lies in the left fifth intercostal space in the mid-clavicular line. The arch of the aorta begins at the level of the manubrious sternal joint and the midpoint of the manubrious sternum overlies the T5 to T8. C7 is the vertebral prominence. It is the first clearly palpable spine, although the spine of T1 immediately below it is in fact the most prominent one. Sternal angle at T41 is ibis sternal joint at T9. Regarded division of the mediastinum, superior mediastinum is divided by an imaginary line go through the T4, T5. Inferior mediastinum conventionally divides into three parts. The descending aorta lies in the posterior mediastinum within the thorax. The pericardial sac and contents form middle mediastinum. The phrenic nerve, the contents of the middle mediastinum, pericardium and heart, great vessels, lung roots, phrenic nerve, deep cardiac plexus. Root of esophagus vein, esophagus, right vagus nerve are directly related to the root of the right lung. Conduction system of the heart composed of specialized muscle tissue. Right bundle branch originate at the membranous part of the interventricular septum. AV bundle divides into right and left branches at the membranous part of interventricular septum. Septomarginal trabecula contains branch of right bundle branch. Atrioventricular node is situated in interatrial septum. Above the attachment of the septal cusp of tricuspid valve to the left of the opening of the coronary sinus. SA node is supplied by right coronary artery in 60% population. Regarding right coronary artery, anastomosis with the circumflex branch of the left coronary artery. Right coronary artery arises from anterior aortic sinus. Right coronary artery gives posterior interventricular artery in majority of individuals. 90%, 10% is replaced by the continuation of the circumflex artery. 10% තමයි ඒක. එතකොට 90% posterior interventricular artery in majority of individual. Right coronary artery gives of posterior interventricular artery in the majority of individual 90%. The right coronary artery supply කරන atrial wall of the left ventricle. Right coronary artery obstruction leads to myocardial infarction. Embryological aortic arch derivatives ගත්තාම first arch එක maxillary arteries, second are stapedial arteries. Distal portion of the sixth arch become ductus arteriosus. Distal portion of the sixth aortic arch. The derivatives of embryological aortic arch ගත්තාම fifth arch එක disappear වෙනවා. Sixth arch on right side become pulmonary artery. Fourth arch on right side becomes right subclavian artery. The inferior angle of the scapula is at the level of the T8 vertebra. Aortic valve right is the second intercostal space. Pulmonary is left second intercostal space. Spinous processes of all thoracic vertebra are palpable. Suprasternal notch is at the lower border of T2 vertebra, T2 to T3. Cipisternal joint is at the level of the T9 vertebra. Left phrenic nerve is related to lateral to the aorta. Left phrenic nerve, left vagus nerve lies lateral to the aorta. Descending thoracic aorta travels through aortic opening.